Welcome to our essential guide on preventing central line-associated bloodstream infections, or CLABSI. Central lines are lifelines for many patients, delivering medications and fluids directly into the bloodstream. But they also present a potential pathway for bacteria to enter the body, putting patients at risk for serious infections. Think of it like this. A central line is like a bridge over a river. If that bridge isn't properly maintained and protected, it can become dangerous. Today we'll discuss the measures healthcare providers take to keep that bridge, that central line, safe and secure. The first line of defense, hand hygiene. Hand hygiene is absolutely crucial in the fight against CLABSI. Every healthcare provider, before they even touch a central line, must thoroughly wash their hands. This means using soap and water, scrubbing for at least 20 seconds, getting under the fingernails, between the fingers, the whole routine. Proper hand hygiene is like putting on a suit of armor, protecting patients from those invisible enemies. Hand hygiene needs to happen before and after any interaction with the central line every single time. It's a simple act, but it makes a world of difference. Chlorhexidine, the pre-op powerhouse. Before a central line is inserted, the skin around the insertion site needs to be prepped with chlorhexidine. This antiseptic solution creates a barrier on the skin that helps keep bacteria at bay. Chlorhexidine is incredibly effective at killing a broad spectrum of bacteria and even some viruses and fungi. By using it to prep the skin, we're significantly reducing the chances of infection. Full barrier precautions, suiting up for safety. Inserting a central line is a sterile procedure, requiring masks, gloves, gowns, and sterile drapes. The goal is to create a sterile field around the insertion site to prevent any germs from entering the patient's bloodstream. This meticulous attention to detail is paramount in preventing CLABSI. The femoral vein, a route best avoided. The femoral vein, located in the groin, is associated with a higher risk of infection. It's close to the groin, an area that tends to be warmer and more moist, creating an environment where bacteria can thrive. Movement in the groin area can increase the risk of the catheter irritating the vein, creating another opportunity for infection. Whenever possible, healthcare providers should opt for alternative sites like the internal jugular or subclavian veins. Timely removal. Limiting the window of risk. A central line is a valuable tool, but it's important to remember that it's a temporary measure. The longer a catheter remains in place, the higher the risk of infection. It's like leaving a window open in your house. The longer it stays open, the more likely bugs will fly in. That's why it's crucial to remove the central line as soon as it's no longer medically necessary. This simple act can significantly reduce the risk of CLABSI. Protecting patients, preserving trust. By following these evidence-based steps, healthcare providers can significantly reduce the risk of CLABSI and protect patient health. By adhering to strict infection control measures, we can ensure that patients receive the life-saving treatment they need without unnecessary complications. Thank you for watching, and stay informed for a safer healthcare environment. It's a team effort, and by working together, we can make a difference in the fight against healthcare-associated infections.